Good morning and good afternoon, wherever you are. I'm going to let some music play for about the next 2 minutes, let some more people join the room, and we will get started at about 2 minutes after 12.
Black men listen up. I care. Wherever you leave, whatever you do, remember, health is wealth. Whatever you do, this post-breast cancer needs everyone to care. This global illness needs everyone to care. Now wherever you go, you go. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We like it. We will win. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We like it. We will win. If we fight for one love, we won't fail if we fail love.
All right. Hello, everyone. Welcome in. My name is Bims Odedina. I am the media director here with iCCaRE Consortium, and I'm very excited to be hosting today's session. We have a very impactful lineup for you ahead. It's centered around education, awareness, and real conversations that matter. In today's webinar, we'll be featuring segments from two powerful series, Men's Health Matters and Clinical Trials Demystified, which is a new show that will be premiering on YouTube for the very first time after today's session. Now, both of these programs are designed to break down complex health topics as well as make them more accessible, relatable, as well as relevant to the everyday people. In Men's Health Matters, we focus on the real life experiences surrounding men's health, especially within communities that are often underrepresented in these conversations. And in Clinical Trials Demystified, we'll take a closer look at how clinical research works, why it matters, and how it directly impacts patient care and future treatments. Throughout today's session, you'll hear from physicians, researchers, and voices that are helping shape the future of healthcare, while also highlighting the human side of their journeys. I encourage everyone to really take in this information, reflect on what stands out to you, and think about how these conversations connect to your own experiences and communities. And with that being said, let's go ahead and get this started. So, I will be premiering episode 2 of Men's Health Matters, and this episode focuses on caregiving. So, we'll go ahead and start that.
Welcome to Men's Health Matter. I'm your host, AJ Merriweather, and today we have a special guest with us. We have Miss Karen Gainey and Michael Gainey, and today's show is about caregiving. You know, we just want to get the perspective from the loved ones on how they dealt with the diagnosis of a loved one. So joining me in this conversation is the audience. Audience, I'm hoping that you would enjoy this segment because I look so forward to them sharing their journey. So tell me, y'all, How long have y'all been married, and what was life for you before your husband got diagnosed, Miss Karen?
We've been married 47 years.
Whoa, you still with him?
Still, yeah, still there.
Bless your heart.
Life before diagnosis was kind of routine. You know, we had our routine. We get up in the morning, we have coffee time, which runs into board meeting time because Michael is somewhat semi-retired but not quite retired. So we would discuss business and family, future, present, and that was our routine.
Oh, okay. Michael, she gave a good introduction to why she loved you 40-something years. That's a great introduction. Miss Karen,
Yes.
what are your thoughts and feelings when you heard that Michael was diagnosed with prostate cancer?
I can't say that I was scared. I think because of the past history of my health issues and knowing the health issues of family and friends, I knew that it was important to be supportive to the person that just received the diagnosis. So mine was wanting to be as supportive as I could to understand more what he was going through, his thoughts, and to find out as much information that I could to be supportive of him. So to say scared, I wasn't scared. Because things happen, and I just felt that through our faith and with the medical support that we could get through it. It may be difficult, but we could get through it.
But that being said, I wanna elaborate a little bit more. How did that diagnosis affect your relationship in the early stage?
We became closer. Even though we had our routine of coffee time, boardroom time, we now had something else to talk about. So we would either sit and research together, we would talk to others together to learn more about the diagnosis. So our communication became even better. We were more supportive of each other, him of how I was feeling with the diagnosis, and me with how he was feeling with the diagnosis.
And that being said, what were the important things that you did to help support your husband through that diagnosis?
Some of the practical things was, staying up on appointments, being supportive at doctor's appointments to get a better understanding of what was going on. Also emotionally, being there for him emotionally. You could look at a person sometime and see them in deep thought about something, and sometimes it's not always what you say, but how you go about saying it. So emotionally being there with him, wanting to spend more time close to him, not wanting to be apart. I wanted to feel him, touch. And I wanted to hear his voice even more, because by listening to him, I got to kind of understand how he may have been feeling. He didn't always express it in words, but just being close to him and communicating to him, it gave me a at ease feeling.
That being said, Karen, you heard what Micah just said. My question to you would be, you had some health issues. I don't know if you want to discuss them, but being that your health issues was prevalent and Micah was going through his journey, my question would be, Micah was going through the diagnosis, you wasn't feeling well. Did that take effect on your recovery?
Mentally, yes. Physically, I can't. If it was there, I didn't really recognize it affecting me physically. Mentally, it did, because the role was now reversed. Rather than him being my caregiver, I'm now having to be there for him in the same aspect that he's been there for me. I've been dealing with health issues for over 20 years, and he's always been there for me, no matter what. And I've also been involved in support groups because of my health issues. So understanding what the person on the other end kind of sort of needs, it was a little comforting because I had been in his shoes, and I kind of felt that if I returned the same care that he gave me, it would help him with his journey.
That being said, what do you find the most difficult part about that process? Mike being diagnosed with prostate cancer, you dealing with some health issues, but I want to know from a caregiver perspective, when you saw him, did you go to the doctor with him and hear the diagnosis? And if you did, what was you sitting in the office getting that, hear him? I want you to tell me, what was his response? What did he look like when he heard it?
It was a solemn look. It just, you could see the change in his face. I mean, it went from, he wasn't smiling in the office, but it just looked, I don't know, solemn. It just, his whole expression changed. But again, I guess because of the health issues that I've gone through, my faith, the support that I've had, I knew I was there for him. And once we got out of the office, you know, and was able to talk about what we had just learned, the diagnosis and everything, I just felt that together, you know, we could overcome this.
That being said, when he was going through his treatment, did you attend the sessions with him, or he just went?
I did.
And when he came home, let me finish that. When he came home from the treatment, was he wiped out? Was he feeling good that the treatment plan is working? Tell me about how you perceived that.
So I went to the appointments. When he met with the surgeon, the oncologist, radiation doctor, I was there for all the appointments. So I knew step by step what was going on. Before we went into the appointments, we had a long list of questions that we had, but when we left out of the appointments, we didn't have many questions. There were things that had been said that we wanted to research even more and discuss. But I don't know, I wasn't afraid. I wasn't scared for what the outcome was going to be. I had a lot of what ifs, because a lot of the questions that I had, and I think that Michael had been answered. They were really answered, but it was that what if, you know, you just don't know from day to day what if. So that was concerning, but I just didn't let it take over what we needed to do and making a decision on resolving.
During that process, tell me this. How did your faith play a role in you, I won't say taking care of him, supporting him on that journey? How did your faith give you the strength? When earlier you said you was dealing with some health issues. So I wanna go into the faith part. Did faith play a role when he got diagnosed in your house?
Yes, faith played a big role.
In what way?
I felt that it was giving me an opportunity to be even closer to the Lord. The words that I have learned and the understanding that I have has helped guide me that He's going to take care of us. He has laid out the blueprint for us, and if we follow it, we're going to be fine. I mean, it might not be our way, the way that we think the outcome is going to be, but His way. So believing that, you know, Michael didn't put the prostate cancer in his body. You know, So I can't, who do you blame? I can't blame anyone of fault or be overly upset. All I can do is take the information that we have, the learning, the support, and just move forward to take care of it.
And that you use the word support. Do you have anyone supporting you through that journey? As far as family and friends and therapists or support group, because being a caregiver, it takes a lot out of you.
It does.
So my question would be what I just asked you. Did you have somebody there supporting you, because you're dealing with this grown man over here? And you know, when we hear, Karen, when we hear the word prostate cancer, I got diagnosed in 2010. So I'm 15 years out. And I tell you, from my experience, it was a good wife that's kept me going. Miss Kelly, she took them notes, because I ain't hear nothing. When the man said, you got prostate cancer, I went deaf. But what I want to know is, did you go deaf, Mike, when you heard that word?
I didn't go deaf, but I think what it is, it kind of, because I guess being a part of a prostate cancer support group, and you know, it's always in my forefront, because if you're part of that group, you meet with these guys every month and things of that nature, so you kind of, you don't go deaf. The thing is, what I went into what's next mode. Okay, how am I going to deal with this? Where am I, and how am I going to deal with it now? And that's what made things so. And Karen being aware of me in this situation, she was able to support me a lot more, because she knew that I wasn't going to, even though she wasn't scared, I was scared. Okay, and so I wanted to be certain that I was doing the right thing in dealing with this situation. And like I say, I've done my research. I've talked to many people. I talked to my pastor, and I explained to him what was going on with me. Oh man, and me and him, he stayed on the phone for God knows how long, and he started, you know, thinking about other people who had it in our church. And then he called one guy and asked me, would you mind talking to Mike? And we got on, the three of us got on the phone, and three were on the phone, and we talked maybe about an hour and a half on the phone about prostate cancer. And that kind of helped me make some decisions about what I was going to do. So when I met with this one guy, doctor, who told me why I should go one route, it was easy for me. It was easy for me to make that decision, because all the information I had in my mind said this is the route to go, because you want to put it behind you.
This being said, I wanna pivot back to Karen as we get ready to end this session. Karen, what has this journey taught you about yourself?
It's taught me patience, for sure. I feel that there were times and things that I didn't think that I could do, that now I feel more empowered to do it, because, like I said, I've been on the receiving end of care, and now I've had the opportunity to give back that care. So I learned that I can receive and I can also give. And I like sharing with others, and I think this journey has caused me to share more with others that are going through the same thing.
That being said, we got a few more minutes. So since we got a few more minutes, I want to give Miss Karen a little bit more opportunity to share her journey. Karen, you mentioned that you had some health issues. I don't want to put your business out there, but through that journey of your health crises, have it made you stronger for us, your treatments on dealing with some of your inner problems? Have it overwhelmed your household? You the mother, you the grandmother, you the spouse, you keeping the secretary for Mike business on the side. How has that affected you? I really want to know, with all these different arms pulling at you, how has that affected your health?
I don't know. It's like the feeling of what I've gone through has been put more on the back burner. I mean, I still deal with issues daily. They're not going to go away. But when I go to bed at night, you go and wake up with a purpose on what you can do. And my purpose for the day of getting through is first seeing that I'm prepared to help someone else, be there for my family, for Michael, my children, the grands, and family. I like learning, researching, and sharing what I've learned, especially if it's affected me. If you need medical care, I'm one that stresses go to the doctor, especially if you have insurance. There's just no reason that you should not go and get a checkup. I mean, you know your body, and you know when your body is not performing as it should. So for me, I took a step back in things that I deal with daily so I could be there for Michael.
Okay, that being said, Michael, as the caregiver that she is, the lovely lady that she is, that she done said all the right words today. Tell me something, Michael. When you was going through your treatment plans and you was in the tube doing your thing, I didn't hear you answer this question. I'm gonna try it again. I know most guys I met, Karen, when they hear that prostate cancer or cancer, typically we always say we're gonna die. You answered some of it earlier, but I want to go back to that. When you was in that closet by yourself, Mike, and no one was around, you know, did you ever hear someone say, not if, not when, but if it comes back? Did you ever hear the explanation that, yeah, I'm cancer free, but you know, and my therapist always said, you know what, not if it come back, but when it come back, because if you live long enough, if you got that gene in you, sometimes it will rear up. Did that ever come to you when you were in that closet?
Not just in that closet. They come to me all the time. Let me explain that to you.
Okay.
Because that thought crosses my mind for every 3 months when I was going in to get checked.
Mm-hmm.
And I'm like on pins and needles waiting for the results of that check. And because I've heard of people who've been through it and say, well, okay, it's gone, and all of a sudden now it's back. So yes, that thought stays in my mind. And but at the same time, I guess I have to use my faith as a big opponent here, and that helps me because I could do all things through Christ Jesus who strengthened me. So therefore, I can't worry about it. If you're gonna worry about it, don't pray about it. Okay? So my thoughts are pray about it and keep moving. You know, so that I can't sit back and say, well, I'm gonna worry about maybe hip. And I know that's a big possibility because it happens all the time. But I can't sit back and say, well, I'm gonna worry about it. Yeah, I think about it, but I don't worry about it as such. But when I take that test every 4 months, you know, I'm on pins and needles certain. And then when they say, okay, Mike, you cleared undetected, I'm great. But I know there's a great possibility that it can come back.
So as we get ready to end this session, I want to give y'all a couple closing remarks. Miss Karen, if you had to tell another woman, another sister, another mother about the role that you play when someone has been given bad news, what would you say to them?
Be there for them physically and mentally. If they're not providing you information once they're diagnosed, kind of be that person that brings up the conversation that helps them pursue more knowledge of what's going on. Tell them that they are their best advocate with the providers. They need to know what is going on with their body, why they're suggesting certain things. So read up on the condition you've been diagnosed with or your loved one has been diagnosed with. Prepare a list of questions and have those providers answer those questions. If that provider is not listening and answering those questions, it's time to move on. I have been in situations where I know my body is changing, but I have had providers that have actually listened And I know they listen because of the outcome of some of the findings. So you've got to find someone that is going to listen, whether it's a friend, provider, minister, find someone that's going to listen to you. Talk to them and learn as much about yourself as you can and your loved one. Be there for them.
That being said, I'd like to take this opportunity to thank Mrs. Karen Gainey and Mr. Michael Gainey for coming on the show today and sharing their experience. I know it's not easy telling someone about your journey, but I'm hoping that someone will hear something that you both said as a couple. And I'd like to take this opportunity as the host to say thank you so much for coming on. I am your host, AJ Merriweather for Men's Health Matter, and we'd like to thank the Gainies for coming on and sharing their journey.
All right, so that was episode 2 of Men's Health Matters. And we wanted to take a moment to recognize a group that is so often present, but not always seen, and those are the caregivers. When a man is diagnosed with a serious condition like prostate cancer, the focus naturally shifts onto his treatment, his recovery, and his journey overall. However, standing beside him every step of the way as well is often a wife or a partner, daughter, sister, or a loved one who takes on the responsibility of caregiving. And this role is not a small role at all. Caregivers are managing appointments, they're asking the hard questions, they're providing emotional support, and in many cases, they're carrying that weight of uncertainty while also trying to keep strong and stay strong for their loved ones. They're navigating diagnosis, treatment decisions, side effects, and even life after treatment. What makes this even more important to highlight is that caregiving doesn't stop when the treatment ends. The physical, emotional, and mental toll can continue years after. And yet, so many caregivers push through silently while putting their own needs to the side. This is exactly why we felt like it was necessary to dedicate this particular episode to the conversation, because caregivers are not just a part of the journey. They're the backbone of it. Their strength and their advocacy and their presence can directly impact outcomes, quality of life, and the overall experience of care. And we do also want to acknowledge that this perspective was initially brought up from Dr. Belagico. She recognized the importance of elevating caregivers' voices in conversations around men's health. Because when we talk about improving outcomes, advancing care, and supporting patients, we can't do that fully without supporting those who care for them. So to every caregiver who's watching, we value you, we see you, and your role matters more than we could fully express. And also to everyone else, let this be a reminder that health journeys are rarely walked alone. It does take a community, a support system, and often an unsung hero behind the scenes. Thank you for joining this important conversation on caregiving. Now I'm going to play episode 1 of Clinical Trials Demystified.
I am Dr. Opeyemi Bolajoko, a research associate with the iCCaRE Consortium. I will be your host on Clinical Trial Demystified, behind the big story concept. So, what is clinical trial anyways? Before any medicine saves a life, it must first pass through a journey of rigorous testing. That journey is called clinical trial. I welcome you once again to Clinical Trial Demystified, where science meets the people. I am a prostate cancer scientist of 8 years of experience, and I am honored to be your scientific host for Clinical Trial Demystified. Today, we answered the foundational question, which is, what is clinical trial anyway? And now we're going to look at the science explained. Clinical trial tests new medicine approaches in 4 phases. In phase 1 check, safety is considered. Phase 2 explores effectiveness, while phase 3 compares with existing treatments. And in phase 4, we monitor long-term impacts. Before any trial begins, it must pass through strict ethical and safety check by an institution, an institutional review board, or IRB. The 4 phases of clinical trial will be explained shortly. Every medicine, vaccines, or treatment you've ever used had to go through a journey called a clinical trial. Now, let's walk through the 4 main phases of clinical trial. Phase 1. The question will be, is it safe? Most researchers test the treatment in small group of people to make sure it is safe. They are looking for side effects and figuring out the right dose. Is it safe? That is the big question here. It's the big question in phase 1. Phase 2. Does it work? Next, more people try it. Researchers check if the treatment actually works and how well it works. If it works, they also keep an eye out for safety. Does it do what it's supposed to do? These are the questions asked in phase 2. Then we move on to phase 3. The question here would be, is it better? This is the big test. Hundreds or even thousands of people take part in this phase. The new treatment is compared to what already exists or what's already available. Is it better or just as good with fewer side effects? These are the questions asked in phase 3. Then we move on to phase 4. Here, this is real life checking. Even after approval, the journey isn't over. Researchers keep watching how the treatment works in real world over time. Does it stay safe and helpful for everyone? These are the questions asked in phase 4. Every phase of clinical trial is a step to make sure that treatments are safe, effective, ready for the people who need them most. And remember, you can be part of that journey. You're welcome to another question. The question we're asking now is, what's at stake in clinical trial? Without participants, there is no progress. Without diversity, there is no accuracy. Consider BD, a drug for heart failure, in early trial. It failed. It showed no benefits, partly because the participant pool lacked diversity. But a later trial focusing on African American patients revealed a significant survival benefits. The drug was ultimately approved specifically for Black patients. It was a turning point, but also a reminder that without diversity in trials, we miss the full story. We must all be in science. That means you too.
Hello everyone, my name is Quincy Wimberly. I'm a current program coordinator under the iCCaRE Consortium, and I wanted to turn our attention to prostate cancer trials actively recruiting. The trial, MRI-guided cryoablation for focal native prostate cancer, is exploring a highly precise treatment approach. What is it, you ask? An interventional phase 2 study using MRI-guided cryoablation, a technique that freezes tumor tissue under real-time imaging to treat localized prostate cancer. It's minimally invasive and focused. Who is eligible? Men with localized prostate cancer, stage 1 or stage 2, confirmed via conventional staging and suitable for focal therapy. What they'll evaluate: safety and effectiveness in eliminating tumors while preserving healthy tissue and minimizing side effects. Outcomes include tumor control, urinary and sectional function, and patient quality of life. This trial highlights two key advancements. First, using MRI guidance gives unparalleled precision. And second, focal therapy offers men an option that balances cancer control and quality of life. It's currently enrolling at Mayo Clinic locations in Rochester, Minnesota, and Scottsdale, Arizona. Men who fit the criteria and prefer a localized treatment may want to ask their urologist whether this could be the right fit for them. Learn more by searching clinicaltrials.gov for NCT 04797039, where full eligibility and site information are available. Trials like this are expanding treatment choices, giving patients options that are tailored, precise, and evidence-based. That's medical progress at its best.
And so that was episode 1 of Clinical Trials Demystified. And as we wrap up this first episode, one thing should be very clear. Clinical trials are so much more than just a step into the research process. They are the bridge between discovery and real-world care. From phase 0 to phase 4, each stage plays a critical role in making sure treatments are not only effective, but also safe, ethical, as well as accessible. And while science can feel complex, at the center of every clinical trial is something very simple: people, patients, families, and communities. What you saw in this very first episode today represents the future of medicine in motion. It's precise and evolving, and it also increasingly focuses on improving and not just survivorship, but also the quality of life. Clinical trials can't move forward without participation, trust, and awareness. For many communities, especially those historically underrepresented in research, there's been a bit of hesitation, and for good reason. That's why education, transparency, and advocacy are so critical, because everyone deserves access to the latest advancements and the opportunity to be a part of shaping them. Whether you're a patient exploring your options, a student considering a future in health science, or someone passionate about health equity and advocacy, understanding clinical trials gives you the power. The power to ask questions, the power to make yourself informed, the power to be a part of something bigger than just yourself. Clinical trials are not just about testing treatments. They're about creating possibilities. And as you've seen today, these possibilities are already changing lives. Now, I do see here we're at 11:40. I do want to go ahead and play another episode of Clinical Trials Demystified, but this will be an interview with our host, Dr. Biological interviewing physician, Dr. Floyd Willis. So I will go ahead and start that.
Hello, viewer. I'm Dr. Opeyemi Bolajoko, a research associate with iCCaRE Consortium. Today, we're going to be discussing clinician researcher on clinical trial, diversity, and trust. We have Dr. Willis in the studio today to help us understand the landscape. You're welcome, Dr. Willis.
Thank you. I'm pleased to be here. I'm Floyd Willis. I'm a family physician and the medical director for the iCCaRE project. really have spent most of my career seeing patients, but for a number of reasons, got really interested in community outreach and research. So I'm very happy to be here.
It's really good to know that. So before we go forward, we'd like to ask you to share with us one fun fact about you.
One fun fact. I don't know how fun it is, but it's an interesting fact anyway. That so I grew up in a little town, Forsyth, Georgia, and my parents were both about 46, just shy of 46 years of age when I was born. So my mother always said she went to the doctor and they told her she had a tumor because her uterus and tummy was bigger, and they were very concerned about that. And she said, I think I'm pregnant because tumors don't kick.
That's really cool.
But it was really interesting. So I had a very happy childhood in that little town, but it was really interesting that my parents were friends with all of my other friends' grandparents. Because by the time I got 10 years of age, they were 55. But I think it, even back then, gave me a soft spot for older people. I kind of watched them. They were pretty healthy.
Yeah.
But
can
it
imagine
made
that.
you pay attention when it's your parents, maybe a little bit more than when
Yeah.
it's your grandparents. But anyway, my mother probably could have named me Tumor and gotten away with it. But I'm glad she didn't name me Floyd. So anyway, and that's a whole nother
That's
story.
really
But,
cool.
well, I'm glad to be here.
That's really cool.
Share that fun fact.
Yes. So today we're going to be, you're going to be helping us understand the landscape, the current landscape of clinical trial. But I'm going to start with a few questions and wanted to explain to us why diversity is important in scientific research.
Just to clarify for everybody, I did not start my medical career as someone with an interest in community outreach, engagement, and research. I really was seeing patients and very, very happy to see patients. It's my passion. But I was approached by a couple of researchers who were having trouble getting enough diversity in their clinical trials, having a lot of difficulty doing it. And it was interesting that the clinical trials were on memory and memory loss. You know, most important work on memory and memory loss is to decide whose memory is not normal and whose memory is normal. In order to do that, there are a lot of tests, paper and pencil tests where they ask you questions and that kind of thing. And it's just really important to have people from all walks of life in those tests, because how can you figure out what's normal and what's not if all the testing is done on one group?
On one group, I can imagine.
So, but again, I'm a family physician and I was minding my own business, doing my work. But they said, this is a really difficult thing to do and we've tried. And I said, well, you know, this is important. We can't have this kind of disease process happening all around us, but we not really understand how to even diagnose it in black people. For that matter, Hispanic people or people that grew up in certain areas where their customs and their language might be a little bit different. How do you compare them to this other group who has a completely different culture, custom, language? And long story short, they asked my opinion on how we would get that, or if I had any opinion. And I said, I really do. I think advertising in the newspapers or just putting something on the radio, I don't know that it will be as effective. And they had tried that. But it had to be deeper than that, and I think the connection with the community had to be deeper than that. And something you and I have talked about before, there has to be trust.
Yeah.
And that's a very difficult thing to measure, you know. You can't put your finger in the air and say, yeah, they trust me. It's discussion and going into the community and doing outreach. And although I was, and I still am, really happy seeing my patients, that is my passion. What I think I realized more and more was that this kind of clinical research would probably lead to better ways to diagnose people, better ways to take care of people. In a lot of ways, it helps people to understand what they should be screened for, when they should go to the doctor, how to recognize these things, because that outreach piece a lot of times gives a lot of useful information to people that otherwise might not know about it. And so I concluded that I really enjoyed seeing patients in the office one-on-one, but that you could do a lot of good if you got out of the office, because, you know, talking to one person in my office is great, but sometimes a different kind of impact can be made if you're talking to 100 people, or you're doing something like what we're doing right now that might get to 1,000 people, and they will say, wow, so really this research makes a difference. I should participate, because in the end I may help me and my children and my children's children when they're discovering new drugs and new treatments.
So thank you so much. That's really amazing. In your opinion, if research is just targeted at a certain population, what do you think would happen if it's just the type of people or type of people that speak certain language that the research is just targeted at them? What do you think would happen if research is not, if diverse participants are not involved?
Yeah, I think that we missed an opportunity to be sure that the research that leads to treatments and therapies might not be as accurate. Yeah. If you only do the research and learn how to treat certain diseases and certain illnesses on one group of people, it's very difficult to say, well, it'll work in all those other people. It's I think, impossible to do that. I mean, from a scientific perspective, I don't think you could. An example is, if you did all the research on men, it doesn't take a scientist to say, well, now, whatever I learned on all those men, I'm just going to use on women. It'll probably be okay.
Oh, no. No.
Right. So the group has to include people from everyone, I think, everywhere, I think.
Thank you so much. This is really very cool. So, as a clinician and researcher, how do you approach people about clinical trial? I mean, discussing this opportunity to participate in clinical trial with them.
Two things about that. The first is I enjoy approaching people about that, but I've had the great privilege a lot of the time of approaching people that I've already established trust with. So a lot of times, I've practiced for 34 years, longer than that if you count before where I currently work. And it's a different conversation when you've taken care of somebody for 5 or 10 years and you say, hey, this project is coming up. I think it will be really good for you and for the community. And a lot of times I think they will trust the fact that I'm not going to send them to something that's going to be dangerous. Beyond that, I say some of the things that we just mentioned, that if I'm familiar with research or a clinical trial, and sometimes people will reach out to people in my department and say, hey, can you help us? We need groups of people to participate. They don't have a good group of folks that typically don't participate in research. They're a little afraid to participate. I would say, some very bad things happen in years past to people from different cultures when they were invited into research. Does not happen anymore, to my knowledge, or if it happens, it's extremely rare. And I just don't be fearful of it. There's way more upside. There's way more to be gained by having a diverse group of people in this project. And what we don't want is for all these fantastic discoveries to be made 5 and 10 and 15 years from now. And they say, well, we don't have enough diversity because the diverse populations just didn't want to participate. Most of the time people get that. They still have questions, but I think if you present it to them the right way, they understand it's in the best interest. Does that answer the question?
Yeah, thank you so much. That's really eye-opening, that we just need to approach them and explain to them the right way. So you have heard you mention trust, and or you also mentioned the importance of talking to people, explaining clinical trial to people. Could you share with us an example of any clinical trial you've been involved in where trust was necessary?
Sure. I think the biggest example was the memory loss project that I talked about, where we really had to recruit hundreds of people. Wasn't particularly going well, but we did two things. We started recruiting through the church, which is one of the most trusted, maybe the most trusted institution in the black community anyway, from which people get this information. They've done that for years. So to funnel that information to the church is just one example. That is what we did. And the other thing is we hired someone who was a church member. They worked in the church. They did not have a biomedical background, but it was very clear that they got along with a lot of people in the church, and the church members trusted this person. And they came to our institution and they were trained to do the work that they were supposed to do in the biomedical sciences. And it worked very, very well. And those are two examples in the same project. Yeah.
That is so exciting.
Yeah.
So exciting that we could have a team member who was not designated an investigator. You know, it's amazing. How did you convince him or her to join the research?
To do it, well, that's another thing. And it still goes back to trust. A number of the projects that I was approached about, which were compelling enough that said, I'm going to leave my office and I'm going to try to work on these things. They were in communities where I was already volunteering.
Okay.
This was not the first time people had seen me. I was already connected with the church and a couple of volunteer organizations, and I had no idea I was going to be involved in any community outreach or research project. So this young lady, I think, we talked, we had met, we had volunteered on projects together, and I think, just like the participants, she I think grew to trust the work that was being done in a way that was different if there hadn't been someone already connected with the institution. So it's an important thing. I think it's a very useful thing. I know all physicians are really, really busy, and I think particularly family physicians, because we spread ourselves pretty thin trying to take care of what's going on in the office. And I think it's probably our nature to be in the community doing other things. It's just I see a lot of our residents and others, they hold that very, very important. And I think that getting out and connecting with the community is very useful to do that way before you talk about a research project. Or go find a biomedical professional, a physician if you can find them, that's already well connected with the community and say, hey, do you think this would be an interesting project for the community to involve with? Would you help?
Good.
Yes. Yeah.
Thank you so much. That's a very good answer. So we work with people that are already in those communities, that the community trusts.
Yeah.
Thank you. You know, as an investigator and a physician, so that's had opportunity to work with studies. So how do you ensure that the participant population reflects the population that the research wants to address?
That's probably not as complicated as it sounds. I think if you're working on solving a medical problem and you know it affects people from all cultures, all skin tones, all races, pretty much got to have people in your project that reflect all skin tones, all cultures, all races. But if you're doing a project and it only affects African American, sickle cell or something like that, people of African descent, or some other projects that I could, some other illnesses that I could think of that only affect one particular
certain population,
you have to be sure that whatever you're studying, you have participants who are affected by that disease process.
Yeah.
And usually that's not just me. The projects are usually very well put together and groomed by a team of researchers. Those decisions are made as a team. As you know, you're an accomplished scientist yourself. But I think that does drive home the point to people who might want to participate in project, that if someone comes to you and says, will you participate in this project, that means this is likely affecting people like you. They wouldn't be asking you otherwise. It most likely affects people like you. So some really good reason to say yes. Let me participate, because I might help myself. I might help future generations of people like me.
So thank you so much, Dr. Willis. It's really important to know that if you're approached for a research, it's probably because it affects people like you. I'm taking that home with me. So now, what would you, or how would you encourage other physicians that are willing to become investigators or to work with investigators, especially in working with community, to recruit participants from the community? What will be your word to them?
Two things, and I don't want to forget the second one because it's really important. It's a project called Project Impact. So remind me if I forget it. But I think number one, in my own mind right this moment, there are a number of answers to this question, but probably number one is some facts that I heard 2 weeks ago. I was at a conference, and multiple people stood up and talked about how long it takes to double the medical knowledge that we have. Whatever we have right now, everything we know, how long does it take to increase that by double? Well, years ago, 10 years ago, 15 years ago, it took years to double that knowledge. These two presenters nowadays, in 3 or 4 or 5 months, almost everything we know about medicine is twice as big, which means there's a lot of medical research going on. You know, pills and treatments, genetics, and epigenetics. It's just a tremendous amount of stuff going on. And people from communities that usually aren't involved in that, they gotta be involved. We cannot let all of this body of work keep growing and people of different cultures, different races, are not involved in that. I just don't know whether it can be done without a large group of physicians participating. I know we're all busy with our patients, but I would encourage anyone that's seeing patients, particularly if they're seeing patients in communities that are most heavily burdened, that just, really have a lot of medical issues. It's all the more important to have those communities represented in all of this work. So I would really, really strongly encourage people to just make, even if it's just a small part of their practice, to try to encourage this biomedical research and encourage the patients from the communities that they work to do that.
Okay. All right. So I do want to be respectful of everyone's time. There was about 10 minutes left on that interview. The full episode from that interview will be uploaded onto our YouTube channel if you would like to finish that. So in this particular episode of Clinical Trials Demystified, it's very important that we understand clinical trials from a patient perspective. And it's just as important to hear from the physicians who also help design, lead, and guide these studies. In this conversation, Dr. Willis and Dr. Bolajico offer insight on what clinical trials look like from the clinical side, how decisions are made, how patient safety is prioritized, and what it takes to move research from concept into care. They also emphasize that diversity in clinical trials isn't optional, it's actually essential. When clinical trials include people from different racial, ethnic, and cultural backgrounds, researchers are better able to understand how treatments work across diverse populations. This leads to more accurate data and more effective treatments, as well as care that truly reflects the needs of everyone and not just one particular group. At the same time, they did also acknowledge the importance of trust from a patient to a physician relationship. For many of the African American communities, there has been a historical and ongoing hesitation when it comes to medical research rooted in past injustices and unequal treatment within the healthcare system. So that reality makes it even more important to approach clinical trials with full transparency, accountability, and genuine community engagement. So that trust can be rebuilt and participation can both feel safe as well as empowering. Both of their perspectives help bridge the gap between science and patient experience, which gives us a deeper dive and a deeper understanding of the intention, responsibility, and innovation behind every single clinical trial. Now, as we come to the end of today's session, I just want to take a moment and say thank you. Thank you for everybody for taking the time to be here, to listen, to learn, and to engage with these important conversations. Whether it was understanding clinical trials, hearing directly from physicians, or recognizing the vital role of caregivers, each piece of content from today's program reflects how multifaceted the healthcare system truly is. These conversations are important because they help bridge gaps between research and the public, between patients and providers, and within our own communities. And the more informed we are, the more empowered we become to make decisions, ask questions, and support one another. We hope today's session gave you not only knowledge, but also a new perspective on the impact of awareness, advocacy, and participation in healthcare. And I just want to thank everybody again for joining, and we look forward to continuing this series with you guys, and we will see you in our next webinar on next Friday. Bye.